Myself, Dr. Sudipta Ghosh, Gastroenterologist, AMRI Salt Lake and Fortis Hospital, Kolkata. Today I will be discussing on constipation and its management. As we all know, constipation is one of the major problem, and it is a very common problem which we see in primary and also in the specialist healthcare services. This constipation has got many causes. Some, as you know, some of them are secondary constipation. In some of the diseases, constipation can happen. If the patient is on some drugs, then they can have this constipation. Problems like hypothyroidism, hypercalcemia, they can also have constipation. So when a patient comes to us with history of constipation and the other problem, then we try to first understand whether it is a primary constipation or secondary constipation. We try to exclude the common diseases which can cause constipation and check the drug list which also can cause constipation. Once we have decided that this is a primary constipation, then we try to find out how many times he go to the toilet. Because the definition of constipation is very different from the Western world and the Indian world. There were few criteria over the years, but the most important thing is the hard stool. Passage of hard stool and defecation is the most important factor which determines whether the patient is constipated or not. And also, when the patient is constipated, then we try to find out whether he or she has got any other alarming signs or not. By the word alarming signs, we mean whether the patient has passed any fresh blood per rectum, or the patient has lost weight, or there is any associated abdominal pain. If they have got any one of those symptoms, like passing blood or weight loss, then we definitely refer to a gastroenterologist who will organize a colonoscopy to exclude any cause of constipation, whether it can be a colitis or it could be a malignancy which is presenting as a constipation. But if there is no such, alarming signs, then what we do, we try to treat the constipation. And how we treat it, there are different ways to treat. Like, anti-constipation laxatives are of different types. One is isopgol and bulk laxative. One is osmotic laxative. Bulk laxative is very good because we often do not take adequate amount of husk or fiber in our diet. So if we need to add form of husk, we can give them either pure isopgol, which is available often as a psyllium husk, or one of those preparations which is available over the counter. They can have this and they can get relief of the constipation. But somebody who is having also bloating and gas formation, we normally don't allow them or advise them to take the bulk laxative because they can cause more of gas formation. There, our choice is osmotic laxative. In the osmotic laxative, the first drug which is most important, which is Dufalac or lactulose. It is available and it is very good effective treatment of constipation. Other than lactulose and lactitol, we often use polyethylene glycol, which you can often remember. This is used as a colonoscopic preparation, but the molecular weight is different. This polyethylene glycol is also available in sachet. We normally advise them to take one sachet twice daily initially, and when they are quite used to it, then we reduce the dose. If this regime does not work, then we try to find out whether the patient has got any slow transit constipation or not. Why am I using a term slow transit? Because there are two types of constipation. One is a normal transit, where the movements of the fecal matter in the colon is normal, and what is a slow transit, where the movement is very much delayed because of colonic inertia. So to find out those things, we often do a test called this is known as colonic transit study, where we ask them to swallow pellets, which is radioactive pellets, and then do the X-ray in 24, 36, and for after 72 hours, and see whether he can excrete all the pellets or not. If we see somebody is definitely having a slow transit constipation, then we use other stimulant laxatives like bisacodyl. There are some new generations of laxatives coming in, like prucalopride and the lubiprostone. But for those drugs, they are not the over-the-counter drugs. Before giving the prescription, one should see a gastroenterologist and do some basic preliminary test to exclude any sinister causes. But to treat constipation in the primary phase, we should change the lifestyle, eat more fibers, and also check our drug chart and try to do our exercise, which will also help in treating the constipation.